All right, well, we'll go ahead and get started. So, good morning, good afternoon, and good evening, everyone. Thank you for joining us for our first plenary talk as part of the Global One Health Initiative 10th anniversary celebration. We will alternate between plenary talk and panel sessions on every Thursday from 8:30 to 10 a.m. Eastern Time until November 4th, when we'll be holding our closing ceremony. And so we hope you're able to join us for these exciting events. Our topic for today's plenary talk is One Health Partnerships in North America. And I'm excited to introduce you to our special guest speaker, Dr. Bernadette Dunham. And Dr. Dunham is a professorial lecturer at the Milken Institute School of Public Health at the George Washington University, focusing on One Health issues. And she's also a member of the National Academies of Sciences, Engineering, and Medicine's Board on Agriculture and Natural Resources. Dr. Dunham's service with the U.S. Food and Drug Administration from 2002 to 2016 culminated in her position as director for the Center for Veterinary Medicine from 2008 to 2016. And she currently serves as an advisor to the FDA One Health Initiative. Previously, Dr. Dunham was an assistant director with the American Veterinary Medical Association Governmental Relations Division and director of laboratory animal medicine, as well as an adjunct professor of pharmacology at the State University of New York Health Science Center in Syracuse. And Dr. Dunham received her DVM from the Ontario Veterinary College, University of Guelph, and was in private veterinary practice for 4 years in Ontario, Canada, before returning to academia to pursue her PhD at Boston University, where she earned her doctoral degree and completed her postdoctoral research in cardiovascular pathophysiology. And our session moderator for today is our own Dr. Sonia Illick, who specializes in food safety and does a significant amount of extension work, forming partnerships with local food producers, handlers, and consumers, among other target groups. And so I'm just going to do a brief slide transition here. Oh, it's stuck. All right, well, with that, I will hand it over to you, Dr. Dunham, and thank you so much for joining us.
Thank you, Dr. Binkley. I would like to thank Dr. Gibrays for the very kind invitation to participate in the Ohio State University's Global One Health Initiative, celebrating 10 years of impact made through research and educational programming. May I add my very warm congratulations to this celebration. As stated by others, the need for Global One Health implementation and support is more important today than ever before as we face emerging pandemic threats such as COVID-19. It's critical that we spread the message and gain support to build One Health capacity locally and internationally. When Dr. Laura Binkley asked me for a title for my talk, I said, let's go with the importance of relationship building and collaboration, because I believe that relationships are important in any project you are undertaking, mainly because they form the basis for collaboration within a team, which ultimately influences the overall project performance. It also takes trust. And when there's trust, people ask for help, they speak openly and honestly, they take risks, and they accept new challenges with enthusiasm. But first off, I'd like to share a few stories about my interactions with the Global One Health Initiative, and specifically with my introduction to Dr. Gibrays, which started via networking, the infamous exchange of information and ideas among people with a common profession or special interest, which often begins with a single point of common ground. Dr. Lonnie King, Ohio State's College of Veterinary Medicine Dean Emeritus and Global One Health Initiative board member, called me back in 2017 and said I needed to meet Dr. Wanwasan Gibrays, a real mover and shaker in the field of Global One Health, as we shared a very strong compassion for advancing One Health locally and globally. Specifically, Dr. Gibrays had initiated the Global One Health Initiative as a veterinary medicine pilot project back in 2007. And as the project grew, the Global One Health Initiative attracted partners, funders, and interest, and was formally established as a university initiative in 2016. Well, during 2016, I joined the Milken Institute School of Public Health at George Washington University, and I had the opportunity to work with a group of Masters of Public Health students to establish the George Washington University Students for One Health group. I believe student engagement in One Health is so important because they will become the ambassadors for One Health, no matter where their careers will take them. The first challenge presented to this newly formed group was to plan and organize an event around the International One Health Day, which is officially celebrated around the world every year on November 3rd. The group went on to compete in the 2016 student event competition for One Health Day that was sponsored by the One Health Commission, the One Health Initiative, and the One Health Platform. And I'm proud to say that the GW Students for One Health were one of the three winners, along with the University of California at Davis and Washington University School of Medicine in St. Louis, Missouri. Moreover, one of the students, Laura Venner, completed her Master's of Public Health and was accepted by the Ohio State College of Veterinary Medicine for the class of 2021. And to further highlight the importance of relationships and networking, my colleague, Dr. Tom Shryock, an Ohio State University alumnus, had shared a copy of the March 2017 Global One Health Initiative newsletter and mentioned that Dr. Cabrez was a colleague of his. And I responded with, "What a small world. Dr. King had just recommended that I meet Dr. Cabrez." I also shared the news that one of my students had just been accepted by Ohio State University, to which Dr. Shryock replied, "I think it would be a good idea to introduce you and Laura to Dr. Cabrez because he's at the College of Veterinary Medicine. He is so easygoing and welcoming that I would be remiss not to make the connection." Dr. Shryock followed through with introductions, and both Laura and I had the honor to finally meet Dr. Cabrez on April 17th of 2017. And we embarked on a fabulous networking relationship grounded in One Health. In turn, I recommended that Dr. Cabrez be invited to speak at the One Health Academy in Washington, D.C., to further enhance awareness of the great work being done by the Ohio State University Global One Health Initiative. On April 25, 2018, Dr. Cabrez gave a terrific presentation to the One Health Academy entitled Win-Win, Building Capacity and Making Grassroots Impact Using the Global One Health Model. Well, following his talk, there were many engaging questions, but I remember asking him what he thought were some of the biggest challenges facing the Global One Health Initiative. And he replied, "How fast things happen in the US system and in other countries is so variable. Things happen much faster here, and things happen much slower depending upon the other country. Our partners need time. And during in-country training, the expectations are different. So we help facilitate and help others understand the differences, courtesy of a motto that we share: maximum flexibility, minimum expectations. You have to be flexible. These are not insurmountable challenges." And I do believe that Dr. Cabrez's comments support something that I stress to my students all the time. First, seek to understand, embrace active listening, have empathy, and learn from walking in someone else's shoes, because lectures and books cannot replace firsthand experiences. The opportunity to travel and study abroad through student internships and externships is phenomenal. The Global One Health Summer Institute is in its 10th year, and it specifically involves faculty from Ohio State and the regional partners delivering modular trainings, interactive workshops, didactic trainings, and applied learning opportunities to build One Health capacity among Ohio State students and Eastern Africa professionals. The Global One Health Summer Institute is a keystone project to Global One Health Initiative's capacity building among Ohio State undergraduates, graduate, professional students, faculty, and postdoctoral fellows. Although the 2021 One Health Summer Institute took place online, they still included trainings on One Health communication strategies, international trade and risk analysis, molecular epidemiology of infectious diseases, including study design and sample size estimation. Kudos to all for making a difference through capacity building. Now, the COVID-19 pandemic has not only opened our eyes to a new era in global health and security, but it has reiterated the need to embrace a One Health approach if we are to be prepared for the next pandemic. We are realizing that microbes, bacteria, archaea, fungi, protozoa, algae, and viruses do not respect any geographical boundaries, and international travel has enabled the rapid spread of many zoonotic pathogens. We need to invest in preparedness rather than our usual reactionary stance, which is both stovepiped and costly. A multidisciplinary One Health approach will break down the inherent barriers that surround our disciplines, our funding mechanisms, our practices, and our educational curricula. Moreover, One Health can assist in showcasing the benefits of collaboration, the sharing of surveillance data, conducting joint analyses, and disseminating information. But I do want to stress that this also needs to happen within the United States. The silo walls are still high on government agencies, as is turf, and the sharing of data is limited. As Dr. Tracy McNamara, the veterinary pathologist from the Bronx Zoo, who identified West Nile virus back in 1999, points out, in the United Kingdom and the USA, there are no compulsory systems for real-time situational awareness of emerging pathogens in veterinary populations, which means we do not have an epidemiological surveillance program for companion animals or wildlife. Yet the variety of multi-open source systems, combined with well-trained analysts, has the potential to produce high-quality, rapidly actionable zoonotic outbreak intelligence. However, few, if any, countries have this capability integrated into their pandemic operations, even though they talk about spillover of zoonotic diseases. Further, there's no specific funding appropriated for One Health at the federal level, although many agencies are laying the groundwork as they set up One Health offices and programs, often on a voluntary basis. But to really make a difference, One Health needs to not only be recognized, but it needs to be funded in a sustainable manner. Human, animal, plant, specifically crops, and environmental health are interconnected, such that a collaborative, multi-sectoral, and transdisciplinary approach, working at the local, regional, national, and global levels, is imperative if we want to be prepared for the next pandemic. Surveillance capacities and data sharing are top of the priority list. Today, more than ever, we need to develop international surveillance programs where data is willingly shared and readily communicated in a universal form. Apples to apples, not apples to oranges. Working together is quintessential if we are to be prepared for the next challenge, and we need to move from a reaction mode to a prevention mode. Building on this compelling global challenge reiterates how important it is to build capacity, to mitigate diseases and associated hazards, to influence science and policy at the interface between and among humans, animals, plants, and the environment. Again, locally, nationally, and internationally. Dr. Gebreys had stated that the global One Health paradigm is a proactive approach that allows building institutional capacity to preemptively prepare and prevent the emergence and occurrence of biological and chemical hazards. Such a proactive approach is known to be cost-effective and could save a large number of lives each year. The World Bank estimates that it costs $3 billion a year to build and operate One Health systems for effective disease control in developing countries. The impact of COVID-19 surpassed $10 trillion within the first quarter of the pandemic. So how does one influence policy and sustain an impact? Well, the Ohio State University's Global One Health Initiative focuses on strategic global partners, opens the door for research partnerships, and builds long-term capacity, which is key for sustainability. And what follows is collaboration. I'm not sure how many of you are aware, but on December 19th of 2019, Senator Feinstein and her colleagues, Senators McSally, Smith, Brown, King, Casey, and Peters, submitted Senate Resolution 462, which was considered and agreed to, declaring January as National One Health Awareness Month to promote awareness of organizations that focus on One Health efforts to improve the quality of life for people and animals, to recognize the efforts made by such organizations in using a One Health approach to prevent epidemics, and to recognize the importance of using One Health approach to simultaneously protect the health of people, animals, plants, and the environment in the United States. Well, I'm very anxious to see us move from an awareness of One Health to delivering action through the implementation of One Health. Dr. Lonnie King emphasizes that we need new ways of looking at public health and the importance of leadership in solving big problems. The pandemic is global, and it takes high levels of collaboration from all arenas, including national security and national economics. We also need to build skill sets, especially cross-cultural, along with thinking for contemporary and transdisciplinary solutions. This means utilizing education as one of the key pathways to breaking down barriers and silos, beginning with K through 12, with systems thinking. We need to improve our interconnectedness. Well, I mentioned a minute ago how important it is to be sure One Health initiatives take place locally and nationally. And sometimes it takes a global statement to help make things happen. Case in point, on the international front, I was thrilled to see the G7 countries, Canada, France, Germany, Italy, Japan, the United States, and the European Union, meet at Carbis Bay, Cornwall, England on June 13th, 2021. And they released the G7 Summit Communique, a shared agenda for global action aimed at beating COVID-19. Specifically, they stated in section 13, to get and stay ahead of the virus, we commit to continue our investing in cutting-edge research and innovation, seeking to ensure that global vaccines remain effective against variants of concern and that effective tests and treatments are available. To this end, we will boost global surveillance and genomic sequencing and swift information sharing needed to enable the rapid detection to combat the virus and its emerging variants. G7 countries should extend every effort to achieve, wherever possible, a level of genomic sequencing of at least 10% of all new COVID-19 samples during the pandemic phase and share genomic sequencing information with existing global databases. And then in section 16, they stated, as G7 countries, we acknowledge our particular role and responsibilities in international efforts to strengthen the global health system and commit to harnessing our unique strengths to support this. We endorse the G7 Carbis Bay Health Declaration and the G7 Health Ministers Communique and the concrete actions outlined to ensure all countries are better equipped to prevent, detect, respond to, and recover from health crises, including in alignment with the international health relations. And we place particular emphasis on improving integration by strengthening a One Health approach across all aspects of pandemic prevention and preparedness, recognizing the critical links between human and animal health and the environment. Well, I really hope this statement will encourage the United States to do more locally and nationally to embrace and advance an integrated One Health approach. Now, the G20 countries will meet in Rome this October 30th through 31st to expand on the work that's been done by the G7 with a continued theme of preparing for pandemics. The G20 high-level independent panel has released their report, which is entitled A Global Deal for Our Pandemic Age, setting out critical and actionable solutions and investments to meet the challenge of an age of pandemics and how to avoid a repeat of the catastrophic damage that COVID-19 has brought to the world. They specifically highlighted 4 major gaps that need to be addressed. First is globally networked surveillance and research to prevent and detect emerging infectious diseases. Second, resilient national systems to strengthen a critical foundation for global pandemic preparedness and response. Number 3 was supply of medical countermeasures and tools to radically shorten the response time to a pandemic and deliver equitable global access. And number 4, global governance to ensure the system is tightly coordinated, properly funded, with clear accountability for outcomes. And they also stated strengthening financing for the World Health Organization and One Health and put it on more predictable footing. Greater and more predictable funding is necessary for the WHO to perform its critical functions and ensure that there are no gaps in the surveillance to action loop and to strengthen the integrated One Health approach. I sincerely hope that the world has realized that no one person, discipline, organization, or sector can effectively address health threats at the human, animal, plant, environment interface alone. Looking at climate change around our globe has further emphasized the need for a One Health approach. The unprecedented and interdependent crises of climate change and biodiversity loss pose an existential threat to people, animals, plants, and nature. We live in a global village, and we need to take better care of our globe and of each other. Consider vector-borne diseases, where insects such as mosquitoes are expanding their geographical domains, spreading Zika virus, dengue, yellow fever, West Nile virus, just to mention a few. Or where ticks are surviving milder winters and their populations are increasing, spreading, for example, Lyme disease. Or the impact of severe droughts and floods that destroy crop production and can lead to food insecurity. Or the increased severe storms and hurricanes and the decimation that follows. Or the increase in wildfires and the harm to humans, animals, plants, and our ecosystems with air pollution and increased CO2 levels. Or increased water temperatures, leading to health threats for humans and animals from harmful algal blooms, red tide, blue-green algae, and cyanobacteria toxins. Utilizing some tools from the National Aeronautics and Space Administration, NASA, can prove very helpful in predicting where and when these harmful algal blooms will occur. The Plankton Aerosol Cloud Ocean Ecosystem, called PACE, this team focuses on the use of PACE satellite data, products, and applications to benefit society and support decision-making in the context of water resources, air quality and health, climate, disasters, and ecological forecasting. And as Dr. Amanda Berrien has stated, humans and animals are not just interdependent with their environment, but indivisible. So people often ask, but what differences can I make in light of all of these complexities and challenges facing us today? Well, if I may, let me share one more true story with you. You and your dog are walking down a street in Portland, Oregon, and you notice the moss on the side of the tree is no longer a healthy green color, but instead it's turning brown and dying. This is an important observation because moss derives all of its nutrition from the atmosphere, whereas the tree derives its nutrition through its roots in the ground. This means that there might be something harmful in the air. So you ask the Environmental Protection Agency and the National Park Service to check this out. And sure enough, the agents agree there must be something in the air that is causing the moss to die. So they sample the air and they find high levels of cadmium and arsenic. Well, this is not good news. So next they put on their Sherlock Holmes hats and they investigate the area. And they find 2 new glass-blowing companies that had not yet put on the appropriate emission controls. The companies installed the correct emission controls, and now the moss is green and healthy, and you and your dog no longer have to worry about the air you're breathing as you go for a walk. The power of observation by one person is critical. We all need to be aware of what is happening in the environment around us, because early interventions often prevent serious ramifications. Moreover, Citizen science engages with communities and operationalizes a One Health approach. Citizen science can integrate the participation of citizens in any project led, for example, by professionals or medical and public health authorities, especially if zoonotic pathogens are detected. And these partnerships can streamline One Health and EcoHealth approach, where findings are used to optimize the health of humans, captive and wild animals, plants, and the environment. As Dr. Lonnie King stated, the human, animal, plant, environment interfaces are intensifying, accelerating, and becoming more consequential. But together, by building relationships and collaborations, I know that we can make a difference by embracing a One Health approach. I want to thank you for the opportunity to spend some time with you this morning, and congratulations again on the 10th anniversary of The Ohio State University's Global One Health Initiative. You have truly demonstrated to the world how to put a One Health approach into action. Thank you.
Thank you so much, Dr. Dunham, for your wonderful presentation, such wonderful insight and advice. We are now going to open up questions for our audience, and I'll hand it over to Dr. Illick to moderate. So if you have a question, please enter it in the Q&A box. Thank you.
Dr. Dunham, thank you so much for this wonderful, inspirational talk and over-encompassing. At this point, we do not have questions in our Q&A section. So I will invite all the attendees to pose their questions. In the meantime, as Dr. Dunham, you were talking, I was taking notes, and I was formulating the question. And each time I had a question, you answered it in the next in the next several sentences of your talk. But several times throughout your talk, you emphasized the importance of education and importance in bridging that gap between the awareness of One Health and amazing resources that we have at our fingertips in terms of available data that we have, amazing advances in data analytics. And then on a local level, we still have basic misunderstanding of scientific concepts. And I think you mentioned several ways that we can bridge that. And I would like to ask you to kind of summarize that point. What are some steps that we need to most urgently take to ensure that education is on One Health and on benefits of One Health, especially towards the potential new pandemics and potential new global threats that we face in terms of public health? What are most pressing needs for education in terms from K to 12 citizen science all the way to through our higher education?
Well, thank you very much. And actually, you laid it out beautifully. Everything you said needs to be embraced by all of us at all the institutions and in our schools. And I think it's very critical that we do start as soon as we can to have our children appreciate and understand One Health and nature and how interconnected we all are, especially for our health issues. And they are, if growing up in our world, understanding this, they can make a difference in how they react. But they need to understand and also appreciate science. And we all know right now, we're facing a real tough time with people not always wanting to believe science. And when we lose that trust in science, which is so quintessential, it sets us back. And so we want to do a better job of having people appreciate and understand science, turn to the facts, turn to the experts with their knowledge in medicine, in environment, in climate, etc., if we're going to move forward. And so having this incorporated with consistency, I think it's very important that we have consistent delivery of information so that we're not hearing different stories. We're hearing the same consistent message through education. And then I think we can have that as a very strong base to build from, and it will grow over time. And as I said earlier, I think through education, our students, when they grow up, they will be the ambassadors very much for One Health and incorporate that in their careers. So I'm very happy that schools of public health are required to address One Health now. And that's going to go a long way to further enhancing that awareness within professional entities. And I think a Masters of Public Health program, for example, bridges beautifully between the other professions, be that veterinary medicine and human medicine. But I think the One Health approach is something that we want through education, people to realize that it's more than just our medical groups or our climatologists or our biologists. We need to bring in our social sciences and our anthropologists and our economists, because they're all part and parcel of helping us work through these issues. And so there's a role for all of our disciplines to enunciate and embrace One Health, and then it becomes the new norm. And when it becomes the new norm, you no longer have to continue to raise awareness. It's doing what the Ohio State University with your global program in One Health initiative has done. And you've now put action into the One Health approach, and that's so important. And then it becomes so easy to be able to continue to do what we need, which is sharing surveillance data, building programs around the globe that will keep that One Health approach working so that we can get into a prevention mode when it comes to diseases rather than reaction. And I think the economic picture highlights, if you can put dollars into a good program, at the very end, you're going to save so much. Think about what you could do with those other dollars for so many other needed areas for health, what's happening with climate change, what's happening across the globe to address these challenges together. So I would just want to see all of us through education continue to build on having people understand that and showcase what they can do to make a difference. Does that help a little bit?
That, Dr. Dunham, that was the most uplifting overview of how we can put all these pieces of the puzzle in place to provide better understanding and kind of frictionless future of Global One initiative. Thank you. And on that note, we had a question or a comment at the Q&A section here. It says, thank you very much for the question. Her question was if there are any models for the engagement of undergraduate students in citizen science that can be adopted for One Health, and can we advocate for funding for such efforts?
Actually, if I may say,
Sure.
there are some very good papers that have been published on citizen science. And if you have the opportunity to capture this person's email, I would be more than happy to send you, Sonia, a couple of very, very helpful papers that really illustrate the breadth of citizen science and how it's being utilized and the opportunity, even in your local area, to embrace and move this forward. I mentioned NASA, and I just want to share very quickly, NASA has an amazing program where they are able to work with an app on your phone for you or your children to collect information, for example, on mosquitoes in your backyard. Have they formed in a container of water? Are you finding them in a pond? And that data is being added to this national network of understanding where and what species of mosquitoes we have and where they're moving. And that's just one example. And it's so simple. And when you think about what we all have with smartphones globally and apps, oh my goodness, the opportunity to gather data and put that on an app so that you sitting back in your office in a different country can receive that and utilize that is fantastic. So there are so many examples, but I would love to share with you a couple of these papers that I've gathered, because I do embrace citizen science and want to encourage all students, K through 12, and all of us as adults in our professional field to step up and make a difference. So if that's okay with you, may I follow through and share some papers with you?
Yes, of course. I already have an email from our participants and they're saying thank you very much. They appreciate these great insights and all the work that has been done also by Global One Health Initiative. Thank you. At this point, we don't have any other questions from our participants. I think exchanging a list of these resources will be wonderful, and we can probably focus on getting this to our participants list. But at this point, I have an email for this particular person who was interested in the resources. Laura has her hand up here. Yes.
So sorry, I'll just
Laura.
speak since I can't enter. But again, such wonderful insight and very powerful messages. One question I have is about sort of building surveillance networks. And this was something that was touched upon at our opening ceremony. So there are, I think, different funding mechanisms to establish these surveillance networks. However, it looks like nothing has really been established here in the United States. So do you have any recommendations for how we can sort of get something like that up and running and connect all of the schools of public health with one another, all of the One Health initiatives? And I know that there are, there's separate, I guess, their own initiatives that try to do this, but what would you recommend to really pull it all together systematically? Yeah, so that's my question.
That's a very good question, and one that I hope others will step up and make this happen, because that's what it's going to take. It just takes a few to start to reach out and pull together contacts at other universities and schools of public health, for example, where they are embracing One Health. Some have come a long way. They even have, University of Florida has a PhD program in One Health. So yes, there are a number of areas where it's more in one area, less in others. But to weave everybody together and to make it easy so you don't have to reproduce things will help. That's always another golden rule. Keep it as simple as you can and build on what we have. Don't have to start all over again. I also think, in addition to having the academic unit try to coordinate and build and share, we also can take advantage of legislation. This can happen locally as well as internationally, nationally, internationally. And right now here in the States, there are a number of bills that have been introduced to try to encourage, for example, an embracing and putting action to One Health across agencies. And as I mentioned earlier, the one thing that we don't have is an appropriation to assure sustainable funding for One Health across all these agencies. So that is something that is being looked at, is being discussed, and hopefully that will pass. And I think, as I mentioned earlier, having statements that come in from the G7 and the G20 at that international level might then hopefully put a little bit of pressure and bring people together so that we can have a sustainable, coordinated funding stream that enables all of this to happen. I think the benefits, as you have shown so beautifully, you save dollars when you're able to work together. And I think that gets back to the surveillance idea of how do you then share information, have people have the opportunity for a similar format. So when they collect this data, on an app, whatever you're going to have, and you share it, it's easy to understand. It's easy to build on that information. And then we can take interventions much quicker. Highlighting all of those wins will hopefully gravitate and encourage others to step up and say, how can I help? I want to be a part of this. And that's usually what it is. And you have 10 years now of fabulous, fabulous experience on making this a reality. Ergo, let me show you how I can help. You don't have to start from scratch. And I think building on that, I can see you all being the leaders to do just what you asked, Laura. Does that help?
Wonderful, wonderful. Thank you so much. Yes.
You're welcome.
We have another comment. We have another comment in the Q&A box saying, thank you for your wonderful elucidation of all critical points on Global One Health, Doctor. So Thank you very much for this. You mentioned several times that obviously finances are a barrier. What do you think the major barriers are to increased funding for global one health issues?
I think specifically here in the States, and thank you again for that question, people have just gotten into their own, for example, their own agencies, they're silo-walled in, they're specific, they're focused, and they don't stop enough to take a look and say, but what's happening around? Because if we did more of that, we'd realize there is so much cross-fertilization that needs to take place, and that can help. And the more that we work across the various agencies, for example, at the federal level, we can reduce an awful lot of redundancy because we can work together more seamlessly. And it's part and parcel of having Congress step up to help make these changes, because we, the individuals, can work beautifully from agency to agency. But many times we're caught with the congressional appropriation of dollars, where you say, what will you do each year with those appropriated dollars? And in order for you to do something a little different, you have to get that approval. You have a certain amount of wiggle room. And that's why we do so much, as I say, even voluntarily, we can coordinate and set up an office. We can do some various projects together. But if you want to have it with sustainability, then it has to come in at this high level where this is recognized and it's supported. And it's going to be sustainable, not just a one-time, one hit. That has to change. And that's where Congress can make a difference, which is why, even as I said in 2019, making January One Health Awareness Month was another way of educating and enhancing that through all of the members of Congress. Now, as members of Congress are elected by the public has an opportunity to have their voice heard. Then you make a difference, because you want to make sure that you're asking them to represent you and to support One Health. The more they hear about that, all of our members of Congress, House and Senate, from the public, that's another major way of pushing this forward and having a success story. Because once they understand the benefits, as we've all highlighted, then I think we can get into actually funding One Health, recognized, dispersed, integrated throughout the agencies. And then we will truthfully have a success story. And the example, again, that you have of 10 years of experience of showing how to do this is exemplary. And once we take that message back more and more, the same message to members of Congress, our hope is that we will see success. And that is going to be what we need in order to have One Health actually put into action here in the States. I hope that helps a little bit.
Oh, yeah. So boiling down back to education and outreach, community education, and taking it back to Congress. Thank you very much for this response. So some more questions are trickling in here in the box. So a participant says, thank you for speaking today on this important topic. Could you share your opinion on what progress we have made globally in the past 5 to 10 years on antimicrobial resistance?
No, that's a very good question. Thank you for asking that, because yes, antimicrobial resistance is the poster child, I think, also for One Health, because it is an international issue. And we have come a long way. We have now programs throughout the globe where countries are establishing at various levels their own surveillance program, their testing, their education and awareness of what we mean by antimicrobial resistance, how we actually have to sustain the health of people, animals, and plants by embracing a stewardship of program, to be very careful on how we use and prescribe the use of antibiotics, to document this. And that's what's happening now globally. We need more of it, because if anything, I might even say that antimicrobial resistance is like a silent pandemic, because individuals are impacted by this. But when you end up going to the hospital and you're being told, I'm sorry, I don't have an antibiotic to treat your particular bacterial infection because the bacteria has developed resistance to the drug, that becomes very serious. The COVID-19 pandemic was a virus, and it's one, as we saw, can spread and impact so many. But the importance back to the silent pandemic, as I'll call it, for antimicrobial resistance is still very, very important. And we want to make sure that we sustain these very important drugs to keep people, animals, and plants healthy. So we do have to be able to share information and practices as to how best to coordinate when we use these and how we use these important drugs. And the request for national action plans is something that we have succeeded in doing. We are sharing information now globally more and more of programs that work, but it also comes back again to governance and how the various leaders in their countries were willing to step up and recognize the importance of antimicrobial resistance and how best to help prevent this. Now, bacteria have been around for a long time. They will continue to be around, and they will continue to test us because they are very smart and they continue with the resistance. So now that we're moving into genomics, CRISPR-Cas9, new technologies, we're having new tools that can help possibly slow this down. Will we eliminate it? Probably not. Ergo, therefore, how we use these important drugs, we are the stewards, and we have to all share information again through surveillance of where we're seeing resistant organisms and how we can better use the drugs that we have and hopefully develop new ways of addressing this resistance. Sometimes we might be able to develop some vaccines or phage use. At the same time, keeping animals healthy often minimizes the need for antibiotics, and the same is true for people. But it takes a global village working together for this very important issue of AMR. So thank you for asking that important question.
That is certainly true. And then another question that I have here for you, you touched upon it a little. What is your insight on major challenges for Global One Health approach expansion throughout the globe?
I'm sorry, the very last part of your question?
What is your insight on major challenges for Global One Health approach expansion throughout the globe?
Expansion, I'm sorry. Thank you so much. Sorry.
Sure.
I think it's sort of a combination of everything that I've mentioned today in my talk. It's the more that we enhance understanding of why a One Health approach is needed, the benefits of sharing and working together, of bringing the disciplines needed to come up with creative ways to address these very complex issues, willingness to think outside the box. By yourself, you might do a very good job. But when you bring in other disciplines and other ideas, oh my goodness, the response and capability then of intervention is huge. And it's exciting to work with other disciplines that normally you might not work with. That's the value of this. And as I said, we have to help other countries that may not have the same degree of finances, because in the long run, we all benefit when we can sustain good health for humans, animals, plants, and our environment. And so how we can help share that information, educate, work together is what we're going to need to do. And I'm hoping there's now more and more a willingness by everybody to say, how can I help? Because we will make a difference if we all work together. Thank you.
Definitely. And employing some behavior change tools that we have on our fingertips would probably help align everybody's goals. So we have another question in chat. It said, wouldn't it be wonderful if One Health was present at the practitioner, so vet, med, environment level? It seems to be difficult at a high level policy echelon. How can One Health become just a part of daily life at the practitioner level? For example, knowledge of zoonosis in medical GPs is very variable.
Once again, when you come back to education, right now there's a couple of universities that are literally having classes with medical students and veterinary medical students in the same room. And it is amazing how you'll have the students say, wow, I had no idea that this was happening in your field, especially when it comes to veterinarians, because we get a chance to study all the species, including humans. And so for zoonotic medicine, that's just a natural. And our counterparts on the medical side, now get an opportunity to realize and study and work together. So with that approach, it really blends medicine. And that is so quintessential. When it comes down to it, we're all, as you can say, animals, mammals per se, that we're looking at. And to be able to share that information is fantastic. So the willingness, once again, through education, to bring groups together and to say, I can help you. I can share this back and forth. You know, as practitioners, if you go to see your physician, how often do they ask the question, oh, by the way, do you have any pets? And if so, what do you have? We automatically do that. And we automatically think with a pet in the household, what might be a situation that we need to make sure the owner is educated about? Just think about parasites. Think about puppies and kittens and the fact that there's an opportunity for zoonosis, even through parasites, to have the potential flip over to impact a little baby that's crawling on the kitchen floor that might have had a little puppy make a mess that hadn't quite been all cleaned up. Or think about children where they're so quick to put things in their mouth. We love our pets. They're sleeping with us. They're in our house, etc. How about sharing that back and forth? And it's that approach that the aha goes very quickly. And yet you say, that wasn't very difficult, was it? And no, it's not. And it's that teamwork. It's working together. You know, I would love to see physicians have their offices and right beside them have veterinarians with their offices right beside them. I mean, that sharing back and forth is so important and so easy to do. We just have to be able to reach across the aisle and make it happen.
Thank you very much, Dr. Dunham. At this point, the participant says, thank you for very informative response. It would be great to know which universities are the pioneers in vet med sharing shared One Health education. These exemplars could help persuade others to give it a go.
Well, by far, the Ohio State University leads. UC Davis, Texas A&M, Tufts University, Penn State, Florida. There are a lot. There really are. It's what you said earlier in the question that Laura asked. It's making everybody aware, literally, of what other institutions are doing, because we're just as bad. Sometimes we're so focused in our own university, and even though we have lots to showcase and share, it often doesn't get shared broadly enough. So if we could find a way of enhancing that, I think you'd be overwhelmed and very delighted to see that there is a lot going on. We want more to go on, but I'm already proud to say there is a tremendous amount that's been established, and some of these One Health programs that are being nurtured are phenomenal. So I'm happy to help work with all of you on sharing that information.
Thank you, Dr. Dunham. We have no more questions here. I'm going to invite Dr. Berrien and Binkley to, if they have any other questions. And if not, I think this would be a good time to wish everybody a great day and thank everybody for joining us this morning.
Thank you.
Wonderful, wonderful talk, Dr. Dunham. I'll add my congratulations and thank you for your wonderful presentation. So comprehensive and well articulated. I had a question I was thinking about, and more just kind of a pick your brain while you're here, because something I've been thinking about a little bit more as in academia, so working in both the schools of public health and veterinary medicine on the heels of COVID, or we're thinking about kind of evaluating what could be done better going forward for pandemic preparedness and response. What do you think, making impact where we can? So if we're in academia, that's educating undergraduate, graduate, professional students. If you could, create a course or focus area for the students that are the next generation of professionals that will be faced with these challenges, what do you think would be some of the things that you would want to include that would be lessons learned from where what we've just gone through?
Wow, Dr. Berrien, that's a pretty big question. It's an important one. Yes, we could probably talk about that for quite a while, but again, it's going to come back to having the program set up with that One Health approach being nurtured through the courses and through, as you say, the involvement of the students so that they can appreciate that interconnectedness. So when you have your public health courses, we often lecture, but they don't make the tie-in by saying, this exemplifies or showcases a One Health approach. This shows you how interrelated and interconnected human health, animal health, plant health, and environment is. And if we did that, it's very simple, but it opens up the eyes because many people are still not familiar with the term One Health. And as students, you can ask them, have you heard about One Health? What does it mean to you? The breadth of disciplines that I highlighted earlier, they often don't think about that. Social sciences coming in, as I mentioned, anthropology, behavior changes, economics, law, all of it. We need all of it. But we've got to do a better job of enunciating it. The examples are there. Oftentimes people may be literally executing a One Health approach, but they're not saying it. And they haven't realized that, but we are under that wonderful umbrella of One Health. They just hadn't had that perspective. So in fact, building on that, it's not that difficult. And I think we just have to do a more focused job with our education and our courses and the delivery. Because if the students never hear the professors say One Health, they're going to do great in the course, but they'll miss the boat because it hasn't been displayed that way. And it's so easy to do. And now as we have, as I mentioned, all the examples and specifically what you have here with the Global One Health Initiative at Ohio State, you're able to exemplary show that and be the ones to be the leaders for others to follow and indicate in your courses how this is delivered. Having that energy behind your faculty, the students are going to be enthusiastic and will gobble it right up and will build on it. But you've got to be that nidus to start that awareness and then take it off. Does that help a little bit?
Yeah, absolutely. I couldn't agree more.
Amanda, I'm going to add my thoughts from very practical points of view. So you were creating, let's say you were creating a course for veterinarians, right? So your focus is going to be, we have plenty of material, and as Dr. Durham was going over everything that is essential for Global One Health, there is plenty of material to include in the course. I think the challenge would be how to properly cross-list it in different fields to have the participation of faculty and the students from each of this field. Right, so you are going to have to cross-list it to medical school, to human nutrition, to a public health school, etc. And this is where the true challenge, I think, practical challenge lies. How are we going to make it relevant for all the students that are focusing in their very specific field? So that's my 1 cent on course design.
That's
I think we
important.
have been working on similar courses between several colleges and several departments, and it is a challenge. It's a new, very new approach. So I think that's what we need to kind of we need to master and get to that new norm that it is normal and common to take classes that are cross-listed with different colleges and from different fields.
That is absolutely great. And I think your curriculum it's so hard to change the curriculum, but it's just adding a couple of words. And as you say, if there's a willingness to do so, once you make it happen, it's so easy and it makes it, again, simpler for others to follow. So thank you for that. That's great.
And this is, it is time for us then to wrap up this session. Thank you very much, Dr. Dunham, for joining us today and giving this inspirational and insightful talk and leading the discussion. Laura, do you want to say a few closing words?
Yes, just again, a big thanks to Dr. Dunham for this wonderful, powerful presentation and discussion. And then I would like to invite everyone to join us for next week's first panel discussion titled One Health 101, Why Now and What Next? It will be a formal student panel discussion, really a dialogue among the former GOHi affiliated students, discussing their training experiences in One Health and how others can gain similar experience, get involved, elevate their careers, and really become the next generation of One Health leaders. And this will take place at the same time next week, 8:30 a.m. to 10 o'clock a.m. Eastern Time. So we hope you will be able to join us. And thank you so much again, everyone.
Thank you.
We will conclude. So thank you so much. Have a good day.
Bye-bye. Thank you so much.
Bye.